Hello, and thanks for watching this video from iCarol Crisis Referral and Helpline software. The goal of this overview video is to give you just a little bit more information about what iCarol is and how we aim to help nonprofit helplines. And I'd like to start that conversation by talking about the challenges of operating a helpline today. And there really are a lot of challenges for a nonprofit helpline director or a manager. They've got a population of volunteers and staff that they need to manage and keep track of, be able to quickly get in touch with them and know their contact information, know what skills and achievements and trainings and certifications they've completed, and know what shifts they're doing and what their shift availability is. And also trying to keep them connected with the mission of the helpline and the mission of the organization at large, and having them really understand and buy into that big picture of what this organization is doing. There's also going to be a shift calendar at this helpline that keeps track of all the different shifts that are occurring, and there might be different shifts based on the different responsibilities going on, and number of slots for those shifts may vary, and some shifts may happen on a recurring basis, and the helpline director needs to manage those shifts and also quickly know where there are holes in the schedule, because that impacts the seamless service provided to the community when maybe somebody isn't able to come in or there is otherwise a hole in the schedule. And they also need to know maybe when people are on vacation and who's going to cover in absences, and being able to just in general know how many hours are being done and who's doing those hours. Then it comes time to provide this service, and maybe we first talk about providing this service over the phone, and we can see this is where the helpline director is starting to get a bit overwhelmed, because of course this is such an important task. You've got your community that is calling you, and they need good warm line and empathetic listening services. They might even need suicide prevention or crisis intervention services, and so this is really important that you are there for your callers at their time of need. Now, while you're working with somebody during that interaction, you might need to give them a referral to a community resource, and you need to be able to keep track of those referrals and know all the referral information and being able to keep it up to date when things change at that referral so that you're a reliable source of information for your community. You might want to start looking at taking your services online. And of course, this is really important for helplines to look at, because people aren't using the phone as much as they used to. More and more people want to be able to go online to get what they need, or they want to be able to send a text message to get support. And it's really important that you explore this at a nonprofit helpline, but it can be overwhelming knowing how to translate those services from the phone to online methods of communication and typing back and forth with somebody. So it can be overwhelming thinking about changing your services like that. Then the helpline director needs to know outcomes, be able to run reports on demographic breakdowns or the areas that they're receiving the calls from, or just being able to know how many referrals were given out, how many hours were being worked. And a lot of this information needs to be reported to a CEO or board of directors, or even when applying for grants or reporting to funders so that they can keep getting supported and keep getting funding. And then finally, a lot of hotlines, of course, have certifications and accreditations that they need to maintain. So all of this is really overwhelming. There's a lot of variety of different tasks that a helpline director is dealing with on a day-to-day basis, and it really can be quite daunting. But iCarol aims to come in and help with all of these tasks. At iCarol, we understand the overall business process flow of a helpline, and that's because many of us came from a background of working at nonprofit helplines. And iCarol was actually built by two people who were volunteers on their local nonprofit hotline, and it came from their experience as volunteers, and that's how iCarol came to be. So we understand that people are either calling or maybe chatting or texting with your service, and they're speaking with your volunteers and staff who are then doing some really great empathetic listening. They're giving out good referral information, and then they also need to document that interaction and collect important data. And all of this goes to the director, who then has to analyze that data that was collected, turn it into meaningful reports, and then report to the CEO, board of directors, or funders to keep getting that support, to show the impact and keep getting funded so this helpline can keep operating. Now, the other side of this too is that the helpline director needs to give feedback to her volunteers and staff. It's really important for quality assurance to be able to stay in touch with those volunteers and staff from their documentation, tell them when they're doing a good job and reassuring them so that they feel connected and rewarded in their volunteer experience. And also giving them more critical feedback too, letting them know maybe when they have some things they need to work on, or maybe knowing when they need additional training or on some of the services that they provide. So with our feedback loops within our call reporting forms, all of that feedback can happen right in the same spot where you've done your call documentation and your data collection. And then your volunteers and staff also need to follow up with your community help seekers. This is so important. People, especially who were feeling suicidal or in a crisis, it's a known best practice to be able to follow up with them, to stay in touch with their safety plan, to help them stay safe, and to just keep giving them that support to support them through whatever crisis they're going through. But it's also important to follow up for other purposes as well. You need to collect outcomes and know what your outcome data was so that you can maybe find out if a referral helped somebody or have somebody do a satisfaction survey about how they felt about your service. This is really important for outcomes because this is what you're going to need to continue getting funded. And we have follow-up activity loops within our call reporting forms as well, so you can easily schedule those follow-ups, assign them to a specific worker, and workers can even get notifications and reminders that they have a follow-up due. So there's lots of great tools in there to support your feedback and your follow-up. We also know how important it is to be able to collaborate with partners. We know that so many independently operating helplines will work with other helplines, maybe within their same state or same province, to team together to maybe expand service hours or expand the region in which they can serve. So there's lots of support built into iCarol for that collaboration. For one, you can share your resource database with another helpline. So say helplines within a single region are all covering their own service area and have resources that cover their own service area, but they want to share those resources with others so that if a caller from one region actually reaches a hotline in another region, they can still give good referrals because they've all shared each other's resource databases and can give referrals from those resources. You also may want to share your call reporting forms. Again, these are the forms that you use to collect the data that's coming in and that you're documenting on these interactions. It's really common for helplines to pass their calls on to another center after hours or even build networks where they want to transfer calls. And if you share your call reporting form, you can make sure that that helpline that's taking your calls after hours is collecting all the same exact data for you that you would collect during the daytime when you take your calls. And so it really makes for seamless reporting and seamless statistics to be able to do that. And then you can also build chat and text networks with your partners in your region. You can make it so that somebody can come through a central location and register and then be routed to an available helpline or be routed based on where they are. And so really build these chat and text networks because these are new channels and you might not be ready to go 24/7 with your service, so you can rely on your partners to do that, and iCarol will support you with that as well. So the goal of iCarol is really just to integrate all those different processes and tasks that we saw overwhelming that helpline director on our first screen and bring them all under one roof and have all those tasks work together and kind of be in the same location to make it a lot easier and save you so much time. So you start by entering profiles for your volunteers and your staff. And these profiles keep information about how to get in touch with somebody and what shifts they're doing, what their skills and their achievements are, so that you can quickly get in touch with them and have everybody's information right at your fingertips. And there's other tools within iCarol that help support kind of keeping everyone connected with each other and with the helpline mission. Things like an internal chat where everyone who's signed into that iCarol system can actually send each other instant messages and communicate silently if needed, which is really important in a call center environment. You can also quickly get in touch with your supervisors and staff. There's a news area, an events calendar, a chat board where managers can set up forums for discussion and your volunteers and staff can take part in that conversation. So lots of great ways to keep everyone connected with each other and also with your helpline mission. Now, once people are set up with profiles, they come into iCarol to see which shifts are available. And if you want to put the process in place, you can even make it so that they come in and sign up for those shifts and almost fully automate your shift calendar so that all you need to do is take a look and see where the holes are. And that can really help you spend a lot less time on your shift calendar. And you can even make it so that people can come in and if they've already signed up for a shift and realize they can't do that shift after all, with a click of a few buttons, they can ask for a substitute and a substitution email goes out to all their colleagues asking who can help cover for them. Again, really saving the time that you need to spend on your shift calendar and helping just fill all of those holes that you have in your shift calendar. Now, when people arrive for shift, they're going to use iCarol to document all those different processes or all those different interactions that they have with your clients, whether those are over the phone or through text or chat, or even if you have in-person face-to-face visits or a mobile crisis team or a walk-in clinic. Our customizable call reporting forms are what you're going to use to collect that important data. These are highly customizable. You decide what categories of information you have and what those questions are in those categories, what answers are going to appear as options in a checkbox or drop-down format so you can pull data later on. And you can even add text entry and all sorts of different ways to collect that data. And again, it is highly customizable and controlled by you, because you can actually edit your call forms right directly within iCarol and decide when you want to add a new question and ask something new if you're starting to report for a new grant. So very flexible and really built by you with lots of customization. Now, while you're working with somebody on an interaction, there's a really good chance that you're going to need to give them some sort of community referral to help them further, whether that's professional counseling or a food pantry or a shelter. So in iCarol, you can collect all of the referral information in over 100 different standard fields of information for each referral, and give those referrals out and keep track of which referrals you gave and how often, and then also keep that information up to date, because we know it can be rapidly developing and things change. So you can easily keep that information up to date and edit it at any time. There's even tools in place where you can do more of an automated fashion in keeping those resources up to date. Get your community partners to actually give you their updates right there online, and being able to submit those updates to you, or share your resource database on your website, self-service tools and people being able to search your resources. So lots of great options for information and referral built right into your iCarol system. We know you need to collect data so that you can report back out on it later on. And in our statistics platform in iCarol, there's so many different ready-to-go charts and graphs where you can kind of set your criteria and your filters and run those reports and even copy and paste them right into a grant that you're writing. And in addition to all those ready-to-go charts and graphs, we also have full data export tools available so that you can export all that data that was collected on your interactions and also on your shifts and about your referrals, and being able to export that and do further analysis offline if maybe you like to write queries in Microsoft Access or do some cross tabulation in Microsoft Excel. You can absolutely do that. This is your data, and we're just simply the stewards of it and keeping track of it and storing it for you in an encrypted fashion to really help you provide that service. And then finally, there is a whole host of administrative tools that you can kind of change settings and tweak and adjust things ever so slightly to really fit your helpline's services and the way you do business and your own business practices at your helpline. Because we know no two helplines are the same. Everyone operates a little bit differently. And so there's lots of customization and settings that you can change in iCarol to really make it work for you. So I hope you've enjoyed this brief overview about iCarol and kind of a sneak peek at what iCarol can do. If you'd like to learn a little bit more, please watch our other videos such as our overview tour, our video about chat and text with iCarol, and resource database management. We have lots of videos available, live webinars that you can sign up for, or contact us through our website for more information. Thanks for watching.